An effective pain management protocol in your dentistry service can make an enormous difference in your patients with regards to their recovery and client compliance. If you think about it, pretty much everything we do in veterinary dentistry is painful. They're either in pain when they come in to see us, or whatever procedure we're going to do may induce pain as well. And so if we have a good idea of how to manage that pain, and if we're effective with our pain management protocols, that patient is going to do so much better post-operatively, and client compliance is going to improve as well. If we send a patient home from a dental procedure that's lethargic, vocalizing, not eating, hiding, very uncomfortable, it's highly unlikely that that client is going to return for follow-up dental care. And we have to be so careful with our dental patients because this is an elective procedure. It's not like a spay or a neuter that they're obligated to get that done. Everybody knows you got to spay and neuter your pet, but it only has to be done one time, and even if it doesn't go smoothly, they don't have to ever do it again. With dentistry, we want our patients to come back on a pretty regular basis. And if our patients are not comfortable or not doing well post-operatively, it's going to be very difficult to get them to come back. So we want to make sure that our patients are comfortable, that they're eating, and that their pain is managed well. It also makes a profound difference in their recovery time. They recover so much better, so much quicker, especially in older patients. Pain can really slow down that recovery process. So we are going to talk about some specific protocols. We'll talk about the physiology of pain as well. And pain protocols, there's a lot of agents out there, a lot of different treatment plans, a lot of different combinations of drugs that can be used. And I'm not saying that they're wrong or not good. This is specifically what we use in our dental service that works well with our patients with regards to quick recovery and smooth recovery and comfort level post-operatively. When we discuss pain management and the physiology of pain, we have some terms that we're going to be using that it would be helpful to know the definitions, as we're going to be using these terms throughout the lecture. Noxious stimuli is simply the painful event. Nociceptors are the receptors within the body that pick up that pain impulse and transmit it throughout the body. Nociception is the recognition of the pain impulse by the cerebral cortex. Analgesia is absence of pain without loss of consciousness. Hyperalgesia refers to what would normally be a mildly painful event now becomes extremely painful to the patient. And there's a specific condition that would cause this that we're going to talk about later on. But we have kind of a hyper response to a mildly painful stimulus. Allodynia refers to a non-painful stimulus that now becomes painful. So the patient that would normally not react to the stimulus at all now reacts and picks up that impulse as pain. And again, there's a specific condition that causes that. These last two terms refer to specific agents. We have agonists and antagonists. Agonists enhance the receptor within the body, and antagonists block the receptor. So if we understand how pain works within the body, we can have a kind of a better grip on how to put an effective pain management protocol together for our patient.